Good afternoon. This is Susan Appleton. I am the regional trainer for the Northeast region as it relates to iConnect. And we're going to spend some time this afternoon. I'm going to take your first 30 minutes, and then Caroline is going to take your second 30 minutes, just going through some of the key refresher things that you need to know for iConnect. I'm going to be in the role of a WSC, and what I'm going to go over is provider selection, the person-centered support plan, the HCBS eligibility worksheet, and how to initiate disenrollment. Keep in mind that this is a cursory overview, so we will not go in depth into the person-centered support plan. We are going to have an additional training, a detailed training later on prior to the functionality actually going live in iConnect. So to get started, you'll see here when you're in a consumer's record, our consumer is peanut butter jelly. You want to make sure that you're in the consumer's record and that you're in the correct role. The demographics for this consumer has already been completed for me to be able to be selected as a provider, or for you as the WSC to actually have to this consumer's record and have the appropriate tabs to open when you're filling out notes or forms means that you have to be the provider selected. So how you do that, and you must do that before you go into complete forms, otherwise you won't get the opportunity to have that field open, and I'll show you what I mean. So first of all, for provider selection, you'll see here that you have a provider selection tab. So when you click on the tab, it will open. I've already assigned myself as the worker, and for training purposes, my name is applicable worker. If this did not exist, if the provider selection did not already exist, you would go to provider selection tab, go to file, and add a provider. And you will see here, if you were doing this as your name, when you add a provider, it will automatically populate with your name and the date that it's being done. And then you would proceed to choose your agency as the provider from the dropdown. You would choose the referral type, which would be the waiver support coordinator. And the disposition would be open. As you can see, this is not open for me to choose. There's already a provider on this record. So if we close that, I want to show you what it looks like once it's done. So you go into the record and you complete those fields. You'll see here my name is applicable worker. This was done on the 6th when this consumer was set up. The provider that we're using is training test provider. I am the waiver support coordinator, and the disposition is open. The disposition is open because I am the chosen WSC. Initially, when this is done, it may be WSC selected, and then there's a process. And at the end of the day, I'm chosen, so the disposition is open. You'll notice once that happens, you would do file, save and close provider. If you go to the provider worker tab, you will see now that I am the applicable, I am a worker. These are myself and Caroline, we had done this before. So all of the workers who are associated with that consumer would be on the provider worker tab. Remember in iConnect, if you are on a tab, you have to go to the primary tab in order to close the window. So if we go to file, you fill this out under provider selection. You chose yourself as the waiver support coordinator. You go to file, save and close provider. So that means this consumer, peanut butter jelly, is your consumer. You will be able to access what you need to for this consumer. What I was referring to in terms of filling out the forms, when you go to fill out a form, you go to the Forms tab, and remember, the forms that are available are based on your role. So if you're trying to fill out a QSI assessment, which we know you do not, but as an example, you don't have access to do that because you're not a QSI assessor as a role. So when you go to file, add a form, the forms that are displayed are specific to WSCs, and you won't have the option for forms that are outside of your role. Let's see if we can actually get this to open. Okay, and this is where the lovely word that we use all the time comes into play as it relates to iConnect, and that would be patience. So I just simply logged out of the system, came back in, and I'm going to go and find my consumer. So I went to the consumer tab. I'm going to put in the last name of my consumer, hit go, and here's my consumer. So you just have to one click, go back to the Forms tab, File, Add a Form, and voila. So here, I'm going to choose the HCBS Waiver Eligibility Worksheet. This is the same worksheet, the paper form. The status will automatically come up as draft. You want to change your status to complete. It's going to ask you, is that what you want to do? Now, because you changed the status to complete, you haven't saved the form. So if you fill this form out and then you hit file and close, you've got nothing. So complete means when I finish it, I still have to save it and close it, but it won't be editable once I'm done. This is the key to putting in yourself as a provider selection. Because if you do not, this provider program, and you see the red asterisks are mandatory fields. If you have not put yourself in as a provider under provider selection, this will not open. It will not only not open in forms, it won't open in notes because the system doesn't recognize you as a worker for that provider. So here I'm going to choose the provider, train and test provider, and then I'm going to proceed to fill out what hasn't already populated on the form. You'll see my name, the consumer name, their social is already populated. I need to choose the region. Actually, peanut butter jelly lives in the Suncoast region. The effective date, I'm going to use today's date. Level of care, you have the same options here as you do normally. I'm just going to choose option A, and am I certifying that all of the required documentation diagnosis is available and on the file, which means in the consumer record in iConnect. So I'm going to hit yes. The Medicaid eligibility information is already populated with the Medicaid number. Has the individual been referred for medical eligibility? You want to hit yes or no. If it's yes, you'll see that the dates come up. Now for this training, I'm just simply going to choose today's dates. They're eligible. And again, today's date. Eligibility determination, the level of care has been met, and this particular consumer is going to choose services that are not institutional services. So the form is completed. You're to file, save, and close the form. Your save is successful, and you'll see that the form is now populated with the other form that was already on the consumer's record. So when you go into the HCBS waiver eligibility worksheet after it's been completed, you'll notice you have other areas that you can work with. Reports is a person-centered report support plan. You've got the QSI synopsis report, but this is really what you want, the word merge. The word merge is the actual form. So you go back in, you click on the form under word merge, and you'll see that iConnect will automatically populate everything that you entered into that form on a Word document. It's just like every other document. You want to make sure all of this is completed. This is what you save to your computer, print out, take with you to get the signature. And when you're done, you would come back and put this into a note in the consumer's record. So we're going to fast forward. Say that we have done all of that. You saved it to your computer. You made sure that your information was correct. You took it to the consumer. You have all of your signatures down here, all of the correct dates, and you come back and now you're ready to put this into the consumer's record. So I'm going to close this. You can actually, though, go back into the word merge, and you can access save to a note from here, which will automatically populate a note for you to attach your completed form to. Or you can always go to the Notes tab, File, Add a Note. So let's do it this way. We hit Save to a Note. Now in this instance, it's saving automatically the note that's there, but this is an unsigned note. Many different ways to do it. You could remove this, right? You would go to your division and fill out the information, your APD division. Your program provider is the training test provider. Your note type, you are dealing with a HCBS worksheet.
Okay. Can I see a CVS pharmacy on Beach Boulevard? Is that what you're looking for?
No, sorry. Okay, so you've got waiver enrollment. Where's my note? What's the note?
Note type will be waiver enrollment.
Correct.
And then the subtype is going to be signed waiver eligibility worksheet.
I can't ever find it. Thank you so much, Caroline. Now, what you do, don't do what I did. I'm doing it from memory, but you really should do it from the manual. It'll tell you exactly what to put. The description, you want to make sure you put enough information so at a glance, if I'm looking at the notes tab and I'm looking at all the notes, I can know exactly what this is. If you have any additional information to add to the note about the consumer, you would put it here in the white box, and when you hit append text to note, it will populate that information here with the recorded time. The note is in a complete status. This is where you would grab that attachment, that signed document from your computer, just like you normally would with any other attachment. And then once you're done, you would file, save, and close the note. Now the process in iConnect, remember, it's always the same. I'm going to close this form. So if you wanted to add a note straight from the Notes tab, you didn't want to go back into the word merge, you have your signed document, you go to the Notes tab, you go to File and Add a Note, and the process would be exactly the same. So you can do it multiple ways. So that is your worksheet in terms of the eligibility and how to do the form. Now, the person-centered support plan is not mandated to do in iConnect yet. So what I'm going to show you, I'm going to show the form, I'm going to show how to pull in contacts and medications, and the general functioning of the form. But I want you to be okay because we're going to come back and give you details later on. So same thing, we go to File and add a form. We choose the form that we're looking for, which is the person-centered support plan, and iConnect will automatically populate the form. Remember, it comes up as a draft status. This is, again, a form that you want to put into a complete status. But the beauty of iConnect as it relates to the person-centered support plan is that there is information on the QSI that we want to pull in to the person-centered support plan. So you go to File, you see here, Copy Shared Response. When forms talk to each other and have information that they share with each other, iConnect has made it easy for you to pull that information in from form to form. So if you hit Copy Shared Response, you'll see the QSI comes up. Now, this is the only QSI for this consumer. Say if you had another QSI, you want to make sure that you're choosing the correct one. So when you one-click, all of the information that is relative to the person-centered support plan from the QSI will automatically populate into this form. So you don't have to go and find the QSI. You don't have to look for what it says. Remember to put in, it automatically populates it for you. And you'll see it's grayed out, which means you cannot alter it because you don't have the ability in your role to alter a QSI form. You want to make sure that you do your copy shared response first, because if you proceed to fill out all of the necessary information in this form, and then you decide, oh my goodness, I forgot to copy share response, all of your mandatory information will be removed from the form and you'll have to start over. So File, Open Form, File, Copy Shared Response. Then you want to go to your status and change your status to complete. You'll notice that when this form first opened, it came in an initial status. This is the first this is the first person-centered support plan that I've done for this consumer. But as you work through it, if you have to amend it or if you have to do it for the next year, then you change the review status. And I'm sorry, I'm going to go back. For some reason, this doesn't have open as a choice. This should actually be an open form because it's a working document. It's not complete. So I'm going to go back to draft. And so that I don't confuse anyone, if I put the form, the person-centered support form and plan incomplete, then I can't alter it. So if something changed with the consumer peanut butter jelly, I wouldn't have the opportunity to do it. When it's live, you will have the option to either leave it in draft or open so that if you need to make changes, you can. I'm going to go in, I'm going to choose the provider, and then you'll proceed to fill out the form. The reason that you want to have your medications and your contacts in your consumer record is because here is where that comes into play with the person-centered support plan. So I have a contact in this consumer's record, and I want to make sure that I include it on the plan. So if I hit search existing relations, all of the contacts that are associated with peanut butter jelly automatically populate, and I can choose one. And it will automatically fill in that information. And it'll do that throughout the form. You can add the same contact wherever you need it to be. And if you proceed on down to the form, you have the same opportunity when it comes to medications. So you get down to the medications, and here. So again, I want to pull the consumer's medications that they have already in their record into the person-centered support plan. It will list all of the medications, and then it will populate it into the plan for you. You proceed to fill out the form as normal. If the consumer has a personal disaster plan, you would check yes. Blocks would open down for you here, and you would fill them in accordingly. So that's completing the person-centered support plan. When you're done, you hit File, Save and close the form. And here it is. So the difference between complete and draft, if I open the eligibility worksheet, I can't put any information in there. It's closed off. But because my person-centered support plan is either in a draft or open status, something changed with my consumer, I can open that form, fill in that information, save and close, and move on. Okay. And last but not least for my portion, in terms of how to initiate disenrollment, waiver disenrollment, you're a small part of the process of waiver disenrollment. You initiate the process literally with just a note. So you go into the consumer's record. The consumer is potentially being disenrolled, let's say for non-compliance, and you want to notify someone that that is a necessity, that needs to be done. So you go in to the Notes tab, you go to File, Notes tab, File, Add a Note. Your name automatically populates, the date automatically populates, you choose the program or the provider. Now the consumer is not disenrolled, but your note type is waiver disenrollment because that is the process. However, your subtype is more specific, and your subtype is pending waiver disenrollment. You put in the consumer details here, whatever notes that you need to add to let the receiver know any details. Now this note goes into a pending status. And a pending status note acts as a continual communication. So you're going to send this note to the waiver workstream lead. The waiver workstream lead will look at this note, go into the consumer record, will make any changes that they need to in this note, add whatever details. They will pass this note on to the ROM in the process, and this note will continue so that instead of having 12 notes in a consumer's record about the waiver disenrollment process, because we know it all doesn't happen in one day, like in training. You are traveling the process with one note, one point of reference, and there's not an opportunity to miss anything in the process. So you attach any necessary documents that will give the lead information about why the consumer is in this state. And then you add the waiver workstream lead as a note recipient. By clicking on the ellipsis, I'm just going to find myself. And you'll notice here that I am now the waiver workstream lead. When you hit File and save and close the note, this is the end for now of your part in waiver disenrollment. This will go through the process, and at some point, once the waiver has been determined, the status of the consumer, how to proceed, the waiver lead will send a notice of termination, whether it's for non-compliance or otherwise. Those processes further along will trigger ticklers for you. And of course, we know that you monitor your dashboard because you know peanut butter jelly is in the process of being disenrolled. You look at your ticklers, and if there's a tickler associated with the disenrollment, that's where you'll receive notification that it's time for you to come back into the process. And it's right around the time where you'd have to notify the providers, which is like 35 days after the final termination letter or notification has been sent to the consumer. So that's the extent of what you do for waiver disenrollment. Do we have any questions? Is there any questions in the chat? I don't see any.
Susan, the only thing I'm seeing is a question about whether or not there's another training next week. And at this time, there is not another one scheduled for next week, which was why today was an hour. I don't see anything else in the chat.
Okay. Well, it's now time for Caroline to do her presentation. So Caroline, you should be able to show your screen.
Yes, give me 2 seconds to be on the correct one.
Okay.
Can you see my
Yes.
dashboard? Okay, beautiful. Well, good afternoon, everyone. My name is Caroline Shorter. I am the Suncoast Region trainer, and I'm going to go over, we're going to take it old school and go back to basics and go over the dashboard where you can find the literature to read upon in case you have a process that you need to follow. And we're going to go into editing demographics and how to use the people search or the quick search up top. So you should be able to see my dashboard. Right here it says welcome Caroline Shorter. It will tell you your name. So that's how you'll know that you've logged in correctly. It'll tell you what page you're on, that you can sign out, what role you can select from. You should only have maybe 2 or 3 roles maximum when you log in. And for case management purposes, you will want to be in the WSC CDC Plus. If your primary role is a different role, you'll have to select that and hit go. Without hitting go, it doesn't enable the changes in iConnect for you to access your consumer records as you need to. On the left-hand side, you're going to see the consumers column, and the first item is going to be your divisions. So this is going to be, in essence, your caseload. So right here, I have 5 people who are on the waiting list, 22 people on the waiver, and 3 forensics. So if I click on APD eligible waiver, it's going to pull up everybody who has me assigned as the primary worker who is on the waiver, or if I'm assigned as the secondary worker, which nobody else should be. And then if I click on a line item, it doesn't matter where on this line that I click, it's going to open that consumer's record. And it always opens in the demographics tab, just so you know. All right, file, I'm gonna close this page out and close. So to be safe, always use file and close. If you're in the middle of working on something and you decide to hit this little X at the top, you could accidentally lose your work. So always use File, Save and Close, or Save or Close. The next little panel is provider selections. So you'll notice that I have one that's open. So in essence, right now, when you create your own provider selections for yourself, these consumers will be in open status. And this will, I mean, right now, I can tell that this consumer was assigned to me before December 4th, our go live date, because they weren't transferred to me after that date. And if you click on that line item, it's going to tell you the consumer in which I've got a provider selection for. And if I click on that line item, it's going to open the demographics. Well, no, I'm lying. The provider selections for that particular consumer. So there are multiple ways to get to a consumer's record. This WSC transfer in, this is what you're going to see when a consumer is being transferred to you. If a consumer is being transferred away from you, it's going to be WSC transfer out. And again, just click on the line item and it's supposed to show you that record, but I failed today on you guys. But just like the open tab, if that were still open, I would be able to pull that up. The next panel is the notes panel. If I click on the complete notes cannot be modified. So these, I'm just going to click on this top one as an example. When a note is complete, I can look at it, but I cannot change it. And so I can read through this note. I can open the document. I can see that it was sent to me, but I can't do anything to it. While in the notes page, if I choose to go to tools and mark it as read, we're going to see a change at the bottom. It's supposed to tell us that I marked it as unread, but since I'm in WSC status, I can't do anything without changing the program provider. Hence the reason why we need to make sure that we enter provider selections. So close that one for now. All right. The other way that you can mark notes as read is by checking off these boxes on the left-hand side and going up to tools and marking them as read. As you can see, 4 of the 5 notes were successfully marked as read, probably because of that provider selection. Once complete, you can close that notes panel or page. The next item, since I've marked all of my complete notes as read, they disappear from my dashboard. Here are the pending notes. So I'm just going to go into those, click on one of them. And here is the main difference. So I'm not going to be able to save that note because, again, I'm not selected as the provider selection for this particular consumer. But I wanted to take a moment and show you how to add information to a note. So if you receive a note from someone else and it's in pending status and they are waiting for you to respond, so maybe your liaison sent you a note asking for additional information on a cost plan, you could respond. And then append text to note. So by clicking on this append text to note, it's going to give the date in which I added that text, the time, it's going to indicate the user who wrote the information and my note. And so if I needed to send this back to someone, I could leave the note in pending, click on the ellipsis, maybe choose a person to send it to. I'm going to use you, Susan. And then Let me show you guys. So my box is a little bit too small, but once I enter the name, I can either choose to hit enter on my keyboard or click on that search button. And then I must click on the name in order to select that person. And then once I add them as a note recipient and I file, save, and close the note is going to, it's supposed to appear on their dashboard. But again, the provider selection is super important because you can't save anything if you don't have that. It's not going to let me close it either. Will it? Yay. Okay. So that's notes, a quick reference. The next item are alert notes. Here we have an alert note. If I click on that line item, it'll show me the consumer in which we have an alert note. And if I click on the consumer, it will pull up that note. I can review all that information. And if I need to, once the alert has been resolved, I can go in and change that to complete. And that will remove that alert note status. I can't save that one again. So don't do what I did. Make sure you have your program, your provider selection on file. The next item I wanted to talk about are ticklers. So right now I have 41 ticklers that I need to address. And when I click on that line item, it's going to pull up my listing of ticklers. I can sort all of these columns in all of those lists by all of these different headings. And then if I decide to click on a tickler, I can either open up the workflow wizard and then proceed from there. Or sometimes, let's see if there's one that, nope, that's going to be a workflow wizard. I'm trying to find one that just gives us a little note, but there we go. Okay, perfect. So if you click on one that doesn't have a workflow wizard attached to it, it'll just give you a little note on what you need to do. You can always hit OK, complete the task, later on come back in here. And then once you've completed an item, if it doesn't have a workflow wizard attached to it, you have to come back in and come to this little arrow on the right-hand side and mark it as complete. Any particular tickler that has a workflow wizard attached to it may not necessarily have this complete status to it, especially the ones that have notes assigned to them. So you'll actually have to complete the note from the workflow wizard in order for it to mark itself complete when you save it. All right. We'll talk about authorizations and other items at our next round of trainings. So we're going to go all the way to the right-hand side under tasks. There's the iConnect e-learning library. I'm going to come back to this item shortly. The iConnect help desk, if you click on it, it opens a new page with our iConnect support, their hours, and their phone number. Oops. Under My Management, if you are a supervisor of other support coordinators, you will want to look at My Management. So under the current active cases, if you click there, you should be able to see all of the caseloads for yourself and anybody you supervise. So I can click on the person's, the worker's name. I can click on that plus sign next to their name and open the consumer record from here. So I'm going to click on this consumer's record and it's going to open up the demographics. When you open a record from the My Management cases, you need to go back to your dashboard by clicking on My Dashboard, and then you can go back into My Management, which will pull up the listing. You can select another consumer, and that'll open up their demographics page. Oops. Click on My Dashboard to return to My Dashboard. Pending plans, don't worry about that right now. And ticklers due, we're going to click on that. This is going to show you all of the ticklers due for everyone. So as you can see, Nancy is doing a much better job at keeping up with her ticklers than I am. If you want to go further into the listing, just click on the support coordinator or whomever you supervise, and that's going to pull up the consumer name, the type, the tickler name, etc., etc. If you need to reassign it, you can go to the little arrow on the right-hand side and click reassign. Or you can click on the tickler and then work on it. Okay, so next we're going to go into the e-learning library. If you click on e-learning library, it's going to take you straight to the apdcares.org website with the e-learning library. It's going to have the video modules that you can still access. It's going to have the APD iConnect case management training manual, which you will want to reference for certain things that you have to, or certain tasks that you need to do. If you open the case management manual, it's going to take a little bit. We'll come back to that when it opens. You can click on any of these other PDFs. So iConnect status definitions per tab. If you click on that line item, it's going to open a PDF for you. So this has definitions depending on the tab. So that's your division. And if it's in pending, that's a default disposition. There's application pending. So if you're looking at someone who's a prospective applicant, except you wouldn't see them if you're outside of APD. You guys should mainly see everybody that's waiver. But there's additional information on the bottom. So you can go to the different tabs and it'll tell you all of the different dispositions. Next, adding a WSC provider selection. So Susan just showed you guys that you can add a provider selection. Here are the instructions for that. You'll want to just refer to it, provider selection file, add provider, then it tells you what fields to update. Adding a supervisor, so if you own an agency and you need to add yourself as a supervisor, you can go into these instructions and complete that task. The iConnect quick reference guide, I think, is a spreadsheet with all of the note types and note subtypes that are associated to a particular task. So once you understand how to use iConnect pretty well and you just need to remember what note type and subtype to use, you can reference that here. Adding a medical and mental health diagnosis. Here's another PDF that will help you guys add items to the diagnosis tab. There's another presentation for the waiver disenrollment process, and then adding medications. Here is the manual. I just wanted to quickly show you guys. It's in Word, So depending on the margins, your page numbers could potentially change, but the best way to navigate this is hitting Control F on your keyboard. That should open your navigation on the left-hand side of your screen. If you want to search the document for anything a WSC needs to do, I always enter that as a keyword, and here it'll highlight what chapters you guys are listed in. And so that's a quick way to reference the information that you might be looking for. You can also just go straight to the chapter that you're looking for. So maybe you want to know how you're going to be notified when a QSI assessment's getting done. You could click on chapter 8 and then just review that information there. Okay, so next we're going to do a quick search. And so the consumer that we're utilizing today is peanut butter jelly. So at this quick search, I'm going to search the consumer by their last name. So I'm going to just enter jelly and hit go, and that will pull up the consumer's record. Oh, I'm not a, sorry guys, since Susan was the primary worker for peanut butter jelly, I can't access them under the WSC rules. So let's correct this real quick. So somebody in the waiver unit goes behind the scenes and they're like, okay, we need a new provider selection. So they're going to close out Susan's provider selection. I'm speeding up the process. Let's just say she got the transfer out notification last week. I'm going to add a provider selection. Oh, it was testing one, testing.
It was testing one.
Which one was it? Testing one?
It was testing one.
Thank you.
Try a space.
All right, you guys, I'm not affiliated to an agency today, so I can't add that provider selection. I apologize. But we're going to cheat and update the division record too. Just so I can get some items done for you guys. Thank you for your patience. All right, so quick search, jelly, consumer. So we're searching the consumer. If I hit that drop down, I can change what we're searching by. And last name, I can switch this to iConnect ID or social security number. Even if I have the Medicaid ID number, I can search by these different items. Once I decide, I hit go, and that should just pull up the consumer's record, and it pulls up the demographics tab. We are going to jump into editing the demographics real quick, and then I'll show you guys the advanced search, just to make it a little more seamless. So I'm noticing right here, oh my gosh, peanut butter jelly just moved to the Tampa area, and we need to put a new address in. So how am I going to do this? And they're not in a family home. They're actually in a res hab, maybe a small group home. So I'm going to hit edit demographics. So if you hover over the edit demographics is an option. I'm going to click on this. And here we can change, wait, let me make sure I didn't, okay, it's a Mr. Mr. Peanut Butter Jelly. Maybe he has a middle name, Peanut Butter Grape Jelly. I can add an alias and a title. I cannot add the date of death or this information, but I can choose all of these different items. Maybe single, never married. We find out that he's now living in a small group home. I can change that information right here. I'm not going to change these items, but notice that the Social Security number is not available in the main demographics screen. In order to see the social, you have to edit the demographics, and then you have to click on this little item called Unmask, and that will show you the Social Security number. If there's a Medicare ID number, maybe I'll enter that here. I can select yes or no. I can select a date in which I'm verifying these demographics. For today's purposes, I'm going to select today. And here's where I'm going to edit the address. So one of the main items that you need to remember is clearing out all of these fields, especially when the consumer moves from one city to another, especially, and if they're in different counties, especially if they're in different regions, you'll want to clear out all of these different fields. And so here, I'm going to just enter my go-to address because, so I'm typing all of these in, and you'll notice how it populates a selection. The only way it won't do that if you leave a different county in there, it will get stuck. So just make sure that when you go to change the address, to be safe, just clear out all these fields and type in all the new information. File, when you're done, save and close demographics. All right. And the last item on my agenda is how do I use the advanced search? So let's get that. Here's the advanced search option. You can click on it from either the consumer tab or my dashboard, pretty much any tab. This should be available. And when you click on it, it's going to open a new window and you're going to see this filter. Now, this filter box is available pretty much in all of the tabs, all of the windows. And so here you can put the person's last name. You can search by, you can include a first name. So maybe you have, if you have somebody like John Smith or John Doe, you know, a very common name, you can add additional fields to narrow down your search. I'm going to put contains because I don't want to type in peanut butter. And if I had, you know, a social security number or a Medicaid ID or a zip code where this consumer resides, I could put that in here. That I do know, I just entered this one. I always change that last one to or, and then I can hit search. And hopefully, yes. So since I entered all three items correctly and there's only one consumer, it automatically pulls up just peanut butter jelly. But let's say all I know is this person's last name begins with A. And that's all I know about this consumer. I can hit search. It's supposed to pull up every consumer that is associated with my agency here, and then I can select the line item or the consumer to pull up their record. This is an example of an alert note. It pops up every time you log into the consumer's record. So once you're finished with the alert note and it doesn't need to pop up anymore, you can always go into that note, as I showed you guys before, change the status from alert to complete, and that way it won't pop up on the record anymore. So like if you have a consumer who may be in a rehab facility for a period of time, maybe they're recuperating from a fall and they're going to be there for maybe just a month, you put up an alert note notifying everybody that, they're in a different location for that period of time. And then when they return home, you can change that. And that is pretty much all I was slotted to go over. Are there any questions?
I don't see any questions in the chat, Caroline, and we are just about at our time for today. So if anybody has any questions, please don't hesitate to send them to the iConnect@apdcares.org email address, and we will get the responses out to everyone. And we thank you for your time and look forward to the next time we all get together. So thanks, Caroline and Susan. I appreciate it.
Thank you. Have a great day, everybody.
Bye-bye.